Are you suffering from symptoms of lupus? Have you lost the ability to function independently? Well then, occupational therapy may just be the thing for you. Come along with me as we explore this beautiful world of OT, how it can benefit somebody struggling with lupus.
Lupus is a chronic, inflammatory, autoimmune disease that affects many organ systems. There are 4 main types: neonatal, discoid, drug-induced, and systemic lupus erythematosus, or SLE. SLE is the most common and the one that we will be focusing on today.
With lupus, patients experience what are called flare-ups, times where they have various signs and symptoms. They can also experience times called remission, in which they have no observable signs or symptoms. Lupus can impact multiple body systems such as the kidneys, skin, lungs, and musculoskeletal system.
Signs and symptoms of lupus include joint pain and stiffness, fatigue, fevers, abdominal pain, swollen glands, swelling in the legs or around the eyes, pain with breathing, sun sensitivity, and rashes such as the common butterfly rash, which is redness that spreads across the nose and cheeks.
There is no known cause for lupus, but there are some risk factors that can potentially trigger your immune system. Genetics. If a parent or sibling has lupus, the likelihood of being diagnosed increases. Environmental exposure to viral infections. Smoking, UV exposure, and certain medications and autoimmune responses caused by the body not properly removing dead cells. Additionally, the potential effect that hormones have in regard to lupus is currently being researched. There's a higher risk if a woman is of childbearing age because there could be a potential connection to estrogen.
Lupus can cause a variety of other medical issues as well, such as kidney damage, seizures and memory loss, heart disease, vasculitis, blood clots, low blood cell count, pleurisy, and other severe conditions such as coronary artery disease and atherosclerosis.
Treatment options vary based on the individual and the type and severity of their lupus. A few general guidelines to consider for any patient with lupus are: avoid smoking, eat a proper healthy diet, exercise regularly, and wear sunblock anytime they are outside. Mild to moderate symptoms can be managed with corticosteroids and NSAIDs such as ibuprofen. There is upcoming research into the field of stem cell transplantation for lupus.
This is Linda, a self-proclaimed lumberjack who has been struggling with her symptoms of lupus. She suffers from fatigue, joint pain and stiffness, and inflammation of the lungs, making it difficult and painful to breathe. She lives at home with her husband and young child and is the primary homekeeper due to her husband's long work hours. She values a clean home and has to vacuum every day due to her dog's excessive shedding. Unfortunately, her symptoms keep her from completing this task, as she can only manage to successfully vacuum one small bedroom. Her husband now has to finish the task once he gets home. Linda prefers to utilize her wood-burning fireplace to keep the house warm in the winter, which requires her to regularly chop wood. As her symptoms have worsened, she's unable to keep up with this task, resulting in having to turn on the central heating system. Aside from her homemaker duties, Linda likes to keep active. She enjoys gardening, golfing, and socializing with friends. Linda has been referred to an occupational therapist to help get her back to independent functioning. After completing an occupational profile and initial eval, Linda and the therapist decide to use axe throwing as a means of intervention. It's chosen as an intervention since the kinesthetics and biometrics are similar to those of the activities that Linda is striving to get back to doing. Linda also has a special interest in the activity, since it helps her feel connected to her lumberjack roots and is something that she can go out and do for fun with her friends.
We chose 2 assessments to determine Linda's joint mobility and her activity tolerance. The first assessment seen here is range of motion, which can be measured using goniometers. This can help therapists assess how flexible or mobile a client is to determine whether or not they are within functional limits. Range of motion is free, only some equipment is required. It can be administered in less than 5 minutes per joint. Range of motion has excellent inter-rater and intra-rater reliability and excellent construct and content validity. Another assessment we chose to use on Linda was the Borg rating scale, which is used to measure aerobic capacity. It is used frequently for patients with strokes, neuromuscular conditions, and nonspecific patient populations. It is appropriate for any individual capable of exercising for ages 13 to 65 and older. This test is free for OTs to use and is administered using paper and pencil. The time to administer is 5 minutes. There is a 15-point scale with verbal descriptors to standardize perceived exertion across tasks and individuals. The client's effort is graded using numbers and/or words. The Borg rating scale has excellent test-retest reliability, excellent concurrent validity, and excellent construct validity.
Step 1. Grab or pick up an axe. In this step, the neck is in slight flexion, looking down at the axe. This is a gravity-assisted, isotonic concentric contraction. The minimal range of motion needed for this movement is 0 degrees. Our client's end range is 45 degrees, and you can see here the plane, axis, degrees of freedom, and muscles involved, as well as the agonist and antagonist muscles listed. For the same motion, the right shoulder is in slight flexion, reaching for the axe. It is an against gravity isotonic concentric contraction. The minimal range of motion needed is 15 degrees. Our client achieved an end range of 20 degrees. The right elbow is in slight flexion. This is an against gravity isotonic concentric contraction. The minimal range of motion needed is 36 degrees. Our client achieved an end range of 42 degrees. The right wrist is in slight ulnar deviation. This is a gravity assisted isotonic concentric contraction. The minimal range of motion needed is 10 degrees, and our client achieved an end range of 11 degrees. The right MCPs, PIPs, and DIPs are in flexion, reaching and wrapping around the handle of the axe. This is an against gravity isotonic concentric contraction. The end range for MCP is 10 degrees, for PIP is 50 degrees, for DIP is 40 degrees. Our client's end range is, for the MCP, 12 degrees, for PIP, 52 degrees, and for DIP, 41 degrees. The right CMC, first MCP, and IP joints are in flexion. This is a gravity-assisted isotonic concentric contraction. The minimal range of motion needed for the CMC joint is 0 degrees. For the first MCP is 25 degrees. For the IP joint is 40 degrees. The end range for our client is CMC 0 degrees, MCP 27 degrees, and IP joint 43 degrees. And as you can see here, the left shoulder, left elbow, left wrist, left MCP, PIPs, and DIPs, left CMC, first MCP, and IP joint are all in neutral. The trunk, hips, knees, ankles, and both feet are also in neutral for the neck is in neutral. The right shoulder is in flexion. This is an against gravity isotonic concentric contraction. The minimal range of motion needed for this is 160 degrees. Our client's end range is 165 degrees. The right elbow is in flexion. This is an against gravity isotonic concentric contraction. The minimal range of motion needed is 90 degrees. Our client's end range is 120 degrees. The right wrist is in slight radial deviation. This is a gravity-assisted isotonic concentric contraction. The minimal range of motion needed is 0 degrees. Our client's end range of motion is 10 degrees. The right MCPs, PIPs, and DIPs are in flexion. This is an against gravity isotonic concentric contraction. The minimal range of motion needed for the MCPs is 10 degrees. For the PIPs is 50 degrees. For the DIPs is 40 degrees. Our client's end range is MCPs 12 degrees, PIP 52 degrees, and DIP 41 degrees. The right CMC, first MCP, and IP joint are in flexion. This is a gravity-assisted isotonic concentric contraction. The minimal range of motion needed for this is CMC 0 degrees, first MCP 25 degrees, IP 40 degrees, and our client's end range is CMC 0 degrees, MCP 27 degrees, and IP 43 degrees. The left shoulder, left elbow, left wrist, left hands are all in neutral. The trunk is in extension. This is a gravity-assisted isotonic concentric contraction. The minimal range of motion required for this movement is 0 degrees. Our client's end range is 5 degrees. The hips, knees, ankles, and feet are in neutral. The neck is in neutral. The right shoulder is in extension. This is a gravity-assisted isotonic eccentric contraction. The minimal range of motion needed is 60 degrees. Our client's end range went from 165 degrees to 120 degrees of flexion, demonstrating 45 degrees of extension. The right elbow is also an extension. This is an against gravity initially and then becomes a gravity-assisted contraction. It is an isotonic eccentric contraction. The minimal range of motion needed is 120 degrees. Our client's end range went from 120 to 15 degrees of flexion, demonstrating 105 degrees of right elbow extension. The right wrist is in neutral. The right MCPs, PIPs, and DIPs are still in flexion. This is an against gravity isotonic concentric contraction. The minimal range of motion needed is MCP 10 degrees, PIP 50 degrees, DIP 40 degrees. Our client's end range is MCP 12 degrees, PIP 52 degrees, DIP 41 degrees. The right CMC, first MCP, and IP are in flexion. This is a gravity-assisted isotonic concentric contraction. The minimal range of motion needed is CMC 0 degrees, first MCP 25 degrees, and IP 40 degrees. Our client's end range of motion is CMC 0 degrees, MCP 27 degrees, IP 43 degrees. The left shoulder, elbow, wrist, and hands are in neutral. The trunk is in neutral. The left hip is in flexion. This is an against gravity isotonic concentric contraction. The minimal range of motion required is 20 degrees. Our client's end range is 20 degrees. The left knee, left ankle, and left foot are in neutral. The right hip, right knee, right ankle, and right foot are in neutral. For this movement, the neck is in neutral. The right shoulder is in extension. This is a gravity-assisted isotonic eccentric contraction. The minimal range of motion needed is 5 degrees. The end range is from 120 degrees to 150 degrees of flexion, demonstrating 5 degrees of extension. The right elbow is in extension. This is a gravity-assisted isotonic eccentric contraction. The minimal range of motion needed for this is 15 degrees. Our client's end range went from 15 degrees to 0 degrees of flexion, demonstrating 15 degrees. The right wrist is in ulnar deviation. This is a gravity-assisted isotonic eccentric contraction. The minimal range of motion needed is 0 degrees. Our client's end range is 10 degrees. The right MCPs, PIPs, and DIPs are in extension. This is a gravity-assisted isotonic eccentric contraction. The minimal range of motion needed is MCP from 10 to 0 degrees of flexion, PIPs from 50 to 0 degrees of flexion, and DIPs from 40 to 0 degrees of flexion. Our client's end range is MCP 0 degrees, PIP 0 degrees, and DIP 0 degrees. The right CMC, first MCP, and IP joints are in extension. This is an against gravity isotonic eccentric contraction. The minimal range of motion needed is CMC 0 degrees, first MCP from 25 to 0 degrees of flexion, IP from 40 to 0 degrees of flexion. Our client's end range is CMC 0 degrees, MCP 0 degrees, and IP 0 degrees of extension. The left shoulder, elbow, wrist, and hand are in neutral. The trunk is in flexion. This is a gravity-assisted isotonic concentric contraction. The minimal range of motion needed to complete this activity is 0 degrees. Our client's end range is 5 degrees. The left hips, knee, ankle, and foot are in neutral. The right hip is in extension. This is an against gravity isotonic eccentric contraction. The minimal range of motion required is 20 degrees. Our client's end range is 25 degrees of extension. The right knee is in neutral. The right ankle is in plantar flexion. This is an against gravity isotonic concentric contraction. The minimal range of motion required is 20 degrees. Our client's end range is 25 degrees. The right foot is in slight digit extension due to plantar flexion. This is an against gravity isotonic concentric contraction. The minimal range of motion required is 45 degrees, and our client's end range is 55 degrees.
Kinesiology is the study of motion, as well as the internal and external forces that are involved in movements. Occupational therapy practitioners can use their knowledge of kinesiology to help clients facilitate actions related to ADLs and IADLs, to determine which modifications or adaptive equipment would help them be successful, and to determine the safety of their home and work environments, and to help design therapeutic activities and exercises that can help them progress towards their goals. Biomechanics refers to the application of kinesiology within human movement. By having an understanding of biomechanics, occupational therapists can utilize that knowledge when evaluating and intervening with a client that has a musculoskeletal disorder. While lupus is not a musculoskeletal disorder itself, this disease does impact the organ system, thereby affecting a person's movements.
The American Occupational Therapy Association's 2025 vision states that, as an inclusive profession, occupational therapy maximizes health, well-being, and quality of life for all people, populations, and communities through effective solutions that facilitate participation in everyday living. So what does this mean for OT practitioners? By keeping our services client-centered and creating goals that are meaningful and purposeful to our client, we will be able to keep them engaged and motivated to make progress. As OT practitioners, we should keep the framework's domains of occupation in mind when evaluating and treating our clients. Occupational therapy strives to incorporate a holistic approach by considering a client's strengths, weaknesses, body structures and functions, mental health, spirituality, interests, environment, and support system. We don't want to just get them back to performing their best, but also feeling their best, physically, mentally, and emotionally.
Evidence-based practice question number 1. What evidence depicts or links the relationship of movement dysfunction to occupational performance? Movement disorders affect occupational performance in multiple ways. Movement is required to perform functional tasks and functional mobility, such as washing your hair or vacuuming your house. This direct correlation between movement and functional tasks or activities of daily living indicates that occupational therapy is a needed service for those struggling with movement dysfunction. Evidence-based practice question 2. What evidence exists to support the need for occupational therapists to address movement dysfunction? According to the Parkinson's and Movement Disorder Alliance, approximately 40 million individuals are diagnosed with a movement disorder in America. This demonstrates that there is a need for therapeutic interventions for those struggling with movement dysfunction. Occupational therapists are experts in breaking down activities that are meaningful for their clients. This activity analysis allows for functional movement to be examined in order for the client to continue doing their meaningful activities. This is the whole foundation of occupational therapy as evidenced by the framework. To make Linda more successful, we can build up her axe handle or switch her to a smaller axe. The same can be done at home, like using a lighter vacuum and building up the handle, as well as encouraging Linda to take frequent rest breaks.
Thank you, occupational therapy, for giving me my life back.
Suffering from symptoms of lupus. Oh gosh.
Drug-induced and systemic lupus erythematosus. Erythematomas, or SLE. Did I say that right? Erythematosis.
Okay, I guess I'm ready. Start over.